Since the 19th century, people have been undergoing hair transplantation for a chance at regaining a full head of hair, with the first successful procedure performed in 1897 by Ottoman dermatologist Dr. Menham Hodara. Today, a modern hair transplant is an outpatient surgical procedure where hair is taken from the back or sides of the scalp, otherwise known as the donor area, to areas that are thinning or bald. Once transplanted to the desired area, your hair will generally grow throughout your lifetime. In addition to treating male pattern baldness, these techniques can also be used to restore eyebrows, facial hair, and to repair scars caused by trauma or surgical procedures like facelifts and other prior surgeries. Even though the first modern hair transplant techniques were actually developed in Japan in the 1930s, all hair restoration procedures done today are based on Dr. Bernstein's groundbreaking 1995 publication, Follicular Transplantation. He proposed that the best results are produced when individual naturally occurring bundles of 1 to 4 hairs, called follicular units, are transplanted rather than the grafts of skin with hair used in traditional hair transplant procedures. In this video, we will talk about old and new techniques for hair transplantation. The principle that all hair transplant procedures are based on is called donor dominance. The idea is that your hair retains the characteristics of the donor area when moved and will continue to grow. In addition to regrowing hair, another challenge hair transplant hopefuls would face for years was the large grafts of skin with hair used in the procedure, which created unnatural-looking hairlines and scarring. Today, hair is transplanted in tiny groups of 1 to 4 hairs each, which leave completely natural appearance. This procedure, pioneered by Drs. Bernstein and Rassmann in 1995, is called follicular unit transplantation, FUT. In FUT, the hair is harvested from a donor strip using the stereomicroscopic techniques developed by Dr. Bobby Limmer. While this procedure does supply the highest yield of hair, it leaves a scar in the donor area that can be visible if your hair is cut short. Because of this problem, Dr. Ray Woods from Australia developed a technique where individual groups of hairs could be removed directly from the scalp. In 2002, Drs. Bernstein and Rassmann created their own variation of this technique called follicular unit extraction, FUE. Since then, there have been many improvements to the technique, and follicular unit extraction continues to evolve with robotic FUE as one of Dr. Bernstein's main interests. New research using techniques of regenerative medicine could allow hair to be cloned in the not-too-distant future. With this technology, the limited supply of hair in the donor area could be increased